All right. Hello here. My name's Christopher Lopez. I'm going to be the counselor here, and right here, my assistant here, or my client right here, be playing Gabrielle.
Hi, thanks
Um,
for getting me in today.
yeah, no problem, no problem. Thank you for coming to my dinner here. I would say thank you for choosing me as your counselor. And I've just got one simple question. What brings you in today?
Yes. Okay. So first, I'm really anxious. We found out that we're pregnant with our second child, and I am super excited to have another baby. However, I'm feeling so anxious about this transition that I can't find enjoyment in it. And I want to enjoy it, so I feel guilty that I'm not enjoying it. But I am so anxious thinking about one, I already have a young toddler,
Okay.
15 months old. Two, financially, we're not in a great position to support another human. And then my oldest isn't sleeping well. So now I'm thinking I'm going to have two kids not sleeping well. And I'm worried my marriage, I would love to work on my marriage. And now this is going to take away from our date nights. And I can't live in the present moment. I'm so exhausted thinking about all these things.
Okay. No, that's a lot right there. I can understand and I can relate to that too.
Mhm.
Um, Not necessarily from the female perspective though, but I can offer you a lot of insights that are here though. And thank you so much for sharing a lot of these key points in today, right there. Your anxiety of being a mother to a newborn, financially
Mhm.
stressing out, and then you're having your older daughter now to come into you say a newborn baby too, and then your spouse attention might be you say divided a little more or
Yeah,
less because it might be more tailored towards the baby, or you might be like your husband's usually you guys probably expect a certain amount of affection towards each other, and then it might be
right,
taken down,
right.
and also too leading from stress to anxiety, as we know, it might be even lose some joy of passion too.
Yes, that's exactly
So
it.
I'm just gonna tell you a little right here. If you don't know much about right here, I'm about to tell you about a little about the Adlerian therapy pretty much session, or what I
Okay,
have to offer for you. So it
okay,
kind of just helps you out build more self-confidence, was pretty much what would help you out in your scenario. At least I think so, pretty well. And
okay,
I'm gonna observe some moments and attitudes and some storytelling or recollections we're gonna go about. And I can just tell you quick scenarios about 4 stages pretty much.
okay.
So as you said, we kind of start a relationship right here, like as in like I guess you could say a counselor to a client, or I could be seen as sort of a guide on your
Mhm.
pathway if you want to see it that way.
Okay, that'd be
And then
helpful.
the next part here, it's kind of like assessment. So we'll be looking maybe back at family description, maybe some early moments in your life, maybe some even some current things too. And then
Okay.
after that, but after you tell me a little more about that, we might look more about insights about that, dig into a little deeper right there. So you may tell me a scenario about you maybe getting a bad grade,
Mm,
maybe stress about maybe being fired from a job, or maybe even a stress from being promoted too. It could be like a
mhm.
number of things. Don't have to always be negative, can also be positive things too.
Yeah,
And
that makes
finally, we'll probably look at the reorientation of the whole thing. So maybe some words of encouragement and self-assessments, maybe some little workbooks, maybe possibly we can probably look into.
okay, that all sounds really helpful.
hmm So, like I would say, overall, though, a little more insight too. I mean, I don't, I think it's very good to at least educate yourself a little about the whole thing. So we'll say
Yes, thank
the treatment for the anxiety would be here to learn to forgive yourself, right? And then
you.
move on from your past failures, to call them. And if
Mm,
we wanna better even understand it and reconsider it, but not as, bad thoughts, but as good thoughts to say?
mm. I like that. I'm really hard on myself, so I can't even think about forgiving myself, but I would like to be able to do that.
Yeah, because I mean, sometimes he's saying, like, going back to you as a mother, you might even be a little hard on yourself thinking about, like, "Hey, I can't do this," or maybe you might be like, "Hey, I'm alone?"
Yeah,
And then,
yes.
yeah, more looking into it, like, we can be looking in the direction of taking maybe healthier risk and seeing
Okay.
yourself succeed and, having a better guarantee about what's going on, if that makes sense, yeah.
That I need that right now. The anxiety is so high, and I want to have a more positive perspective on all of this. I think this is a good therapy for me.
Okay. So, I'm gonna ask you a couple of questions here. We're gonna start with the whole life assessment right here. I like to begin with.
Okay.
So, do you mind telling me a little about your childhood experiences overall, just growing up, just in general?
Yeah, I yes, I can. I have um well, one sister.
Okay.
I grew up with a sister. She's 2 years younger than me,
Okay.
and we're good friends now. We fought a lot growing up. Uh, and I grew up with both parents. They were married throughout my life, and yeah, we grew up here in Idaho together.
Okay.
Yeah.
How was your family overall? Like, what do you think about the interactions between your parents and you? Like, how would you relate
Mm.
that?
I would say, let me think. One memory that's coming to mind is I felt like I really had to do well. For example, to earn their approval.
Okay.
So I was really anxious about when I was anxious about things, I noticed that stemmed from wanting to perform well for them. So they were loving and they were awesome, and I felt so much pressure to perform well in order to stay loved.
Okay. Okay. And that's your earliest memory you can probably recall. Like, you think you can recall an early memory, like from like say when? Just the
Yeah,
earliest.
yes, it just came to me. I was 5 years old and
Okay.
I was starting elementary school. And I
Okay.
remember feeling so anxious then.
Of course.
Yeah, wow, I've had a lot of anxiety, but so anxious starting elementary school. And I remember we had just moved.
Oh, so
Um,
just moved to a new place. Oh,
yes.
okay.
So
Okay.
brand new, I'm 5. I'm going into this new school and I'm anxious about, I remember thinking, I have no friends. So how am I supposed to do school with no friends? I'm away from home and all of the things I was familiar with. And all I could think about was, I hope I do well. I'm so uncomfortable. So that's the earliest memory I have starting elementary school, very anxious.
Okay. Okay. So you started right there. Well, is that when you started like in school? How would you say your grades were overall? Like, were you academically like
Yeah, if
achieving, or were you declining because of the new environment change for you?
I would say from as long as I can remember, if I didn't get like a really high grade, I was like, felt like a failure too. I'm like, I need
Oh,
to perform in
you need to
school, I
perform.
need to
Okay.
perform for my family to do well. And like all of that performance made me feel worthy of being loved.
Okay. How did your parents react to you, say, performing well or even performing bad in some instances? Like, say, if Gabriella, if you made 100 one day, like, how would
Mhm.
they act in that scenario? Like, what would they tell you?
Then that was a good day. If I performed well, then like things were going well. And then if I didn't perform well, it was like, oh, you could have done better. I felt just disappointment and like I should have done better and carried that. I really carried that. Just I should have done better. And like that's all I could think about.
And you mentioned earlier you had a younger sister, correct?
Yes.
How did your parents react to her since you said you need to achieve success to get their attention? How did your
Yeah.
younger sister need to act to get your parents' attention?
You know, that's a good question. Now that I think about it, I feel like she had less expectations. So if she didn't do as well, it was kind of like, it's okay. Like,
Like, whatever, yeah.
yeah, it was like there was maybe less pressure on her.
Oh.
And I think maybe because I was the oldest, there was more. Is that common?
Yeah, I mean, judging by the whole when it comes to psychology and you start looking at birth order course with the Adlerian Therapy, you start learning that
Yes.
usually the older children, I mean, I'm an older child too myself, and I can relate to this for your scenario here.
Yeah.
We have, you say, higher expectations from family, and we want
Hmm.
to carry out more traditions, and also our parents want us to succeed too. And
Mm.
also too, we can probably be more of, you could say, a example for our younger siblings too. To kind of be
Oh,
like the example, be more like Gabby, be more like Chris, be more like John, be more like your older sibling, they could be things like that.
interesting.
And then
That
when it comes
definitely happened.
and then when it comes to the younger sibling, obviously there tend to be, according to most theories and research, there tend to be more babied, and I
Oh,
would
okay.
say more or less more relaxed, more relaxed. So I could, I guess you can kind of understand how that goes a little. So you can, if
Yeah,
you imagine your scenario.
that fits my scenario spot on.
So overall, like I said, we can look back at you. We can understand that you want to overachieve a lot and you want to perform well, but
Yeah.
doing those things give you stress or anxiety to call it. And this can kind of relate back to kind of anxiety you're feeling right now as a parent, even though
Mm,
you are already a parent already, but you're about to be a newborn parent again, once again. And now you
yeah.
can have this dynamic too. You could possibly be seeing yourself in your older daughter's shoes too and thinking about like, is this gonna be the same thing too? Am I gonna be as
Mhm.
hard on my older daughter as my
Oh,
parents were me? And would I be
mm,
as babying as the new baby comes out, the newborn? And would I be more, you could say,
yeah.
baby or relaxed on her too, You could think a little about
Wow.
that too.
Wow. I totally can see that happening. And I'm so glad to have awareness of that now.
There you go.
Wow.
And we can go back to a little too, and also too, we can point out some little things too right here. I would just say there's a nice little quote right here from I like to always say from Alfred Adler, the main creator himself. He basically
Yeah,
says the purpose of life is not perfection but wholeness. It's a very simple quote to me though. I mean, take it as it
I
will,
like
though,
that.
but I can probably see that you can basically see like nothing's ever gonna be perfect and things
Yeah.
happen though. But if we look at the whole picture, we
Mhm.
might possibly be happy in that sort of state, if that makes sense, yeah.
Yes, to have wholeness instead of perfection. I'll have more fulfillment and
More
happiness
there
in
you
life.
go, there's the
Wow, that is a shift in my brain. I want to sit with that because that's really good.
Alright,
That's
let's
already
see.
happening.
That's good, that's good. Now, there's a couple of things too we can look at. I mean, in relation to all this, you pretty much told me, like, a lot right here. I mean, very good insights, so I can say right here. And, we
Mhm.
can also say too, you're not alone in this whole situation. You are married, and you do have probably most likely a lovable husband that has a good job too, probably supports you as well.
I do. I do. I forget about the good things when I'm so tangled, but thank you for reminding me of that
Yeah,
because
always remember you like you could say the first time might have been a little tough for both of you guys, but now you could say you guys probably have a little insight on it. You can even say you're a little battled hardened veterans in the sense.
oh, you're right. Like it's our second time.
The
Like
second time
we can do this.
you can do this. And
Yeah.
that goes a little more back into the question. I remember there's one question you did bring about your financial states too, causing the whole stress though. You got to realize
Yeah.
too, were you trying to look for a job too necessarily, or were you just looking
Mm.
to do something part time, or was it just your husband's
Mhm.
trying to get a promotion, or
You want to know what would help is me budgeting. I need to budget better.
oh
And
okay, oh,
if
okay, okay.
I spend less, then I think we'll be okay.
No, that's very good. Budgeting when it comes down to like maybe you can sit down with your husband, you guys can be like, hey, maybe I mean, an instance from my experience right here, my girl right here, she loves Starbucks, or we love to go
Same.
out to eat. We love to go out to eat so often, Maybe we could be like, hey, let's just eat out maybe once a week instead of 4 times a week. Or maybe you could be like, let's just do one Starbucks per couple of days instead of doing one every single day,
I can try. I can work up to that.
Yeah,
Mhm.
I understand, coffee is coffee, coffee is life too, Sometimes there's also alternatives too, maybe possibly maybe going down a different route, possibly maybe more homemade coffees instead of going more store bought, Possibly.
You
I'm
know,
not too sure.
I did just receive an espresso machine as a
Oh,
gift.
there we
Seriously.
go. Oh,
So
we can
maybe
put
I
it to
can
good
work
use.
on, yeah, making some more. That could really help us.
That's good right there. I'm already glad to hear you already have something already kinda already helping out already.
Yeah, you're sparking a lot of good ideas, like, and if I just implement those, I think that'll really help my stress.
That's good. So, like, we can like I said, the final way of, like, reorienting everything we just pretty much talked about, we can look at ways to look at different scenarios or different aspects of the way, right? So, we can look at ways of encouragement, positive self-talking, some
Mm,
relaxation exercises, going back to encouragement, kinda like I was right there telling you, know, "You got this, Gabriella, you got this, you're a battle-hardened veteran, it's okay." You could be like, "I'm a good mother, I've done this before," and plus you can even say, "I am not alone." And then this is something I'm just thinking of right here, some phrases though, but you can repeat back yourself a phrase or two, or maybe you can think of some like you can think of one phrase right now, or not, we can probably come back to another session and you could probably tell me another phrase you might think of, you know.
okay. I do want to hold on to I am not alone. I am not alone. And I I've done this before. I can do it again. I
There you go.
really like those 2. I've
And
done this
then
before.
like I said, more positive reinforcements. Like I said, just make sure you know you're not alone this whole thing. That's the main thing. And I'm here too if you need to talk to about some more stuff. Your husband's be here. Obviously, you have a good relationship with your sister too. You have a very loving family, you know.
Yes. That's really helpful. I didn't realize I had these resources, like, right in front of me. I was so caught up in anxiety. Thank you for helping me uncover that.
Okay, yeah, no problem, no problem. And to reiterate some more stuff back and then I was gonna say, I can even send you in an email or some pamphlets today about the
Okay.
whole therapy session, maybe some relaxation therapy sessions too, you can tell to yourself. Maybe even some more articles if you'd like to read about that. I do know a lot of my clients do like to read more about some material to get more insight. Because just because
Yes.
I told you something too, maybe you might want to read it yourself and be like, "Oh, that's what I remember Chris talking to me about. I remember that," or "This is very good insight."
I love to read. So, yes, please send those.
And I also do have a book recommendation too for you, and I will definitely show you that too, and that definitely might help. I see you're telling me you
I'll
do
write it
like
down.
books too.
Got a few. Yep, I'll write that down. Yes. What's the name of it?
It's a positive reinforcement right here, book right here.
Okay.
Yeah.
Awesome. Sweet.
It's
I
by,
can't wait.
Doctor John Lugbo.
Okay, sweet. Thank
There you
you.
go. It's a very good read, very good read.
Sweet. I'm excited to keep learning and going.
And overall, if you have any more questions for me, you can let me know right now. If not, we can definitely see when a next, appointment might be available for you if you wanna do another session, maybe same time next week, if that works for you.
Same time next week works great for me. I'd love to sign up.
Alright, thank you so much, and I hope
Thank
you feel a
you.
little
I
better
feel so
today.
much better after one session. So thank you.
No problem. You have yourself a good one now. Bye-bye.
Thanks.